Dr. Zach Coller is here from St. Thomas, the Sleep Center, to talk about lack of sleep, which is all too common in our society. Good to have you here, Dr. Coller. So is there a magic number, or does it just depend on the person, how many hours of sleep do we really need a night? It really does vary from person to person.
Vary, but it really depends on age. And so the average adult would require about 8 hours of sleep a night, okay? But it will vary. So some adults may require 7, some require 9. It just depends on how much you need to feel rested the following day. But that's where the younger populations require more sleep. So a teenager, for example, requires about 9 hours of sleep. And a child in elementary school, like 2nd, 3rd, 4th grade, they require around 10 hours of sleep per night.
Wow, I didn't realize that much sleep. Okay, so that is normal. All right, not getting enough sleep, it's not just feeling bad the next day. It truly can lead to, over time, to some illness, right?
I mean, sleep is vital to life. We have to have it. Sleep deprivation, I think it's important to realize that sleep deprivation can be both intentional, which is when we don't allow for enough sleep time, don't allow enough time to sleep, or it can be unintentional, which could be from a sleep disorder, for example. But lack of sleep can actually cause things like weight gain and obesity, and that can lead to things like diabetes. Sleep deprivation can have significant cardiovascular problems that can develop, like high blood pressure, coronary artery disease, increased risk for stroke. If you're sleep deprived, mood disturbances can happen, like depression or anxiety. In fact, it can even affect your ability to ward off infection. You could be getting sick more often. And lastly, you don't feel good and you have impaired cognition. And that can lead to impaired work performance, or even it can be fatal if you're driving while drowsy, for example.
I remember doing a medical story on this and sleep apnea years ago, and the connection with weight gain, saying that a lot of people, when they're tired, they tend to eat more. And I don't know if eating, unhealthy foods, but that's very common to try to wake up or to feel better, to get energy. And it, in fact, has negative repercussions, obviously, down the road.
Right, because the food we eat to stay awake is often not the right type of food for health.
So the healthy benefits, the benefits of sleep to us, overall good health, not just a sense of well-being, but it truly is healthy for our bodies in recovering from illness or anything, right?
Yes, I mean, when you have a good sleep, I mean, you're not only going to feel better, but you're going to ward off those things we just talked about, all those medical and sometimes psychiatric problems. I mean, you just can't get, sleep is really important.
What are the different types of sleep disorders? The one I've heard about the most is sleep apnea.
Sure. And that would be a breathing type of sleep disorder. And so sleep apnea is a disorder in the neck region where the airway is just too narrow and you can't breathe properly at nighttime. You can have disorders of excessive daytime sleepiness, so you can feel really tired during the day, for which sleep apnea is one, but other disorders like narcolepsy, would fall into that category. On the opposite end of the spectrum, you can have insomnia disorders, and that would be where people have trouble falling asleep or staying asleep. You can have disorders of movement, so like restless legs would be an example of that. You can have circadian rhythm disturbances, and that would be problems with your sleep-wake cycle, and that can, people who have that may work, do some shift work or have jet lag. And then lastly, parasomnias, and those are people who maybe sleepwalk or sleep talk or even sleep eat.
I've heard of that, absolutely. Now, is taking a nap a good way to deal with this, or do you advise against frequent napping?
Well, we have to see, why are we napping? Are we napping because we're not getting enough sleep at night? Are we napping because we are getting enough sleep, but we're still tired during the day? It just really depends on why we're doing it. If we happen to take a nap on Sunday afternoons, that's different than saying, I have to nap every day in order to function.
Quality sleep is important. In fact, I just saw a report recently saying if you have interrupted sleep, it's like it's the same thing as not getting enough sleep. If you're constantly waking up, which I'm sure a lot of young mothers deal with, or anybody with young children. So quality sleep is important. How do we get quality sleep?
Well,
$1 million question.
That is a really good question. It's a very difficult question to answer. You have to make sure you first don't have a sleep disorder. I mean, if you have a sleep disorder, no matter what you do, you're not going to win, and your sleep quality will be very poor. But there are some things you can do, just basic things in your own environment. For example, your bedroom should be dark, it should be quiet, it should be a cool temperature. Avoiding things like electronics. You don't want to watch TV before bed or be on the phone or the internet.
Everybody does that, though.
I know,
Everybody
but-
I know does that.
But that really promotes insomnia. And so, I mean, people kind of think that watching television is relaxing before bed, and it is for the body, but it's very stimulating for the mind, and it can lead to a lot of insomnia problems.
Also, the screen on your phone, right? Everybody
blue
says
light,
if you start
yes.
looking at your phone or an iPad or any device, but especially a phone or an iPad, that's stimulating in your brain, obviously. And
It can affect the melatonin in your brain, which can affect your ability to fall asleep.
so should you stop looking at your phone, what, an hour before bedtime, really?
Exactly, I mean, at least an hour. I mean, if someone doesn't have insomnia, it may not be a problem, but if someone has troubles falling asleep, then I would say between 1 and 2 hours before bed is really when you want to wind things down. You have to really separate your day and your night. A lot of people just expect to just go during the day and then fall asleep the moment they find it convenient. And the body just doesn't work that way.
You can't work up until the moment you go to
Exactly.
sleep, or your head, I guess, could be in your iPad or
the computer,
whatever,
yeah.
right? All right, well, these are all good tips, and I realize if people need more help, there's the Tennessee Center for Sleep.com that's been up on your screen throughout the program, tncenterforsleep.com. Thank you so much, Dr. Coller, for your insight, and here's to a good night's rest.
I hear you.
All right,
you.
thank you so much, and we'll be back in just a moment. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.